So when illness strikes you personally or your family members, it really opens your eyes up. For example, I just learned myself that one of a close family members had 2 TIAs, in other words, mini strokes. My mother was just in the emergency room with severe headaches. She was assessed specifically for strokes. And myself, recently, in the last 2 weeks, I went to the urgent care with severe one-sided headache. I wanted to make sure I was not having a stroke. Everything going on, I thought we better make a video addressing strokes and some of the facts about it so that you can be comfortable and make sure that you are going to be okay.
Now, strokes are a very serious matter. They can be fatal or even crippling to some people, so we want to address the 5 signs of a stroke in this video and discuss it more in depth so you know what to look for.
That's right.
But what we all really want to know is what happened to the 3 of you.
Well, fortunately, my brother had complete recoveries. He's okay. My mother, her headache was not a stroke, and the same with mine. There are some other details we won't get into, but again, luckily we're all fine. Make sure that you're going to be fine as well. This video will be very helpful. First, let's define what a stroke is. Now, in the medical community, everyone calls it a CVA. That stands for cerebral vascular accident. And there's 2 different types of CVAs. One is a hemorrhagic, and that's where the vessel actually bursts. Now, this happens in the brain itself, and blood is not allowed to get to the brain, giving it fresh blood, nutrients, oxygen, etc. The other type of CVA is the ischemic, and that's where the vessel actually gets plugged up, blocking blood flow. And again, the brain does not get the blood flow that it needs, and you get symptoms. Now, typically what happens is it's ischemic and not hemorrhagic. They're more common. Mike, you want to talk about a TIA?
A TIA is a transient ischemic attack. This is kind of like a mini stroke. Typically, these are shorter in duration, and most of the time, people make a full recovery from those.
A lot of times people will have mini strokes. They don't even go to the doctor. They recover within a day or so, and they don't even know they had it. But if you do have some of the symptoms we're going to talk about later in the film, make sure you do get to the doctor. We'll cover it in detail.
So if you possibly had one of those 5 signs, what should you do?
Well, actually, before we get into it, a way people can remember what those symptoms are, there's an acronym. It's known as FAST, F-A-S-T. It's popular. I've actually seen it on billboards driving down the interstate. So what does the acronym stand for?
So F stands for face, which we talked about, the face drooping.
A stands for arm. It could be the arm or the leg that's showing some signs of numbness, tingling, or weakness where it's flaccidity, or the arm is dangling, leg is dragging.
S stands for speech, so oftentimes people have speech issues. Maybe they cannot talk at all, or they may have slurred speech.
And T stands for time. So if you have any of those symptoms, what you'll need to do is get to the emergency room as soon as possible, because they actually have a drug now that if it's administered within 3 to 4 hours of initial symptoms, it can greatly reduce the risk of your having long-term problems with it. So time is critical.
Now, the good news is 80% of CVAs can be preventable, and that is through proper medication use or lifestyle choices.
That's right. So here are some things of risk factors that can really increase the risk of strokes, and you can have some control over it, luckily, with a little self-discipline and lifestyle changes, and Mike has mentioned. The first one, if you have high blood pressure, it's a big one. It's the big kahuna. You need to get it under control, either by exercise, diet, or medications. Medications work quite well, but I know I can control mine so far, luckily, with exercise and diet.
Now, the second risk factors are things like diet, cholesterol, and smoking, which can all have effect on arteriosclerosis in the brain.
So that means the vein or the arteries in the brain are actually getting clogged up by either one of those factors. That's a big no-no. That can be corrected.
The third risk factor is being more sedentary. This is obviously correlational data, but typically people that are more active are typically healthier and have less risk of developing a CVA.
That's right. And history, or if your family history of strokes or arterial sclerosis, you really need to watch it. Now, if you have a family history, your parents, aunts, uncles have had strokes or CVAs, that puts you more at risk as well.
And the last risk factor is if you're over the age of 65. Obviously, strokes can happen at younger ages than that, but typically atherosclerosis takes years to build upon, so they're more common with older age. So what are some things you can do to prevent a stroke from happening? And the first one is if you are a smoker, to stop smoking.
Right, that's a big one. The next one is avoid salty foods, processed foods, a lot of sugar, everything that goes along with a good health-based diet.
The next tip is alcohol use. So obviously having some alcohol is okay, but overusing it on a consistent basis can increase your risk.
Right, so they're saying 1-2 maximum drinks per day, and that's as recommended in Wisconsin. That's pretty normal.
1 to 2 12-packs.
I shouldn't joke about it, but the fact is a fact. Let's go on. Reduce stress. That's a big one, and that's where exercise can be a really big factor. If you can exercise off that stretch, go for a walk, go out in nature, get away from everything, let your body relax, breathe naturally, whatever it takes for you to relax and feel good. So if you have one or more of the risk factors we just mentioned, I highly recommend you take action and take care of that.
If you want to check out more videos on stroke prevention, you can click the video link on the screen.
There you go. That's a nice video for more options.
Bob and Brad, the two most famous physical therapists on the internet.